The president just signed the big budget and tax bill into law. What will that mean for the health of Texans? My name is Dr. Leo Lopez. I'm a physician and scientist here in San Antonio. First, let's start with Medicaid. Medicaid is a state and federal health insurance program that provides coverage for low income families, pregnant women, and disabled folks. Most of the patients that I take care of in my clinic every day are on Medicaid. In fact, the program covers about 4 million Texans all across the state. Under this bill, it's projected that Texas could lose out on about $40 billion worth of funding over the next 10 years, and that could result in 300,000 Texans losing their health insurance by 2027 when this bill would take effect. And we know that there are negative health consequences for those who are uninsured, particularly adults who are less likely to receive care for cancer and heart disease. Those are the two leading causes of death here in Bexar County and San Antonio, and drivers of decreased life expectancy. And we know not everybody would be impacted in the same way. We know that if somebody lives on the south side of San Antonio, the south side of Bexar County, their life expectancy might be 20 years less than somebody who lives on the north side. And my concern is under this bill, those unfair differences in life expectancy could be made much worse. Now let's talk about SNAP, or what we know as the food stamp program. We don't exactly know yet how Texas would be impacted, but we do know that major cuts are coming to the program under this bill. We also know that about 17% of Bexar County residents suffer from food insecurity. That's higher than both the state and the national rate. And I'm concerned that under this bill, food insecurity in our community would be made much worse. Ultimately, what I'm most concerned about is what this bill could do to childhood poverty. We know that 19% of the children in Bexar County live in poverty. That's higher again than the state of Texas and the rate at the national level. We should see that as abhorrent and unacceptable and work every day to try and abolish childhood poverty. But this is not a time to cower or to retreat or sit back. This is a time to get activated and engage in the community. Work with your friends and family. Help them re-enroll in Medicaid when the time comes. Get together to cook nutritious meals or to exercise together. Consider volunteering at the local food bank and supporting the cause. Get to know your school board members, the city council, your county commissioners, your state representatives, and ask them to support issues like Medicaid and other food assistance programs. Because ultimately, what it means to be part of a community is that we take care of each other, that we're concerned about each other's well-being. So let's work every day to take small steps forward to make our community a little healthier.